Special feeding management of senior dogs, cats, and horses. How do we feed senior horses? The metabolizable energy decreases with age. Protein, it's at 6%. There's lower protein digestibility. Decreased phosphorus digestibility, increased energy density, so the fat is around 7%, and increased lysine and threonine intake. This is due to you give leafy alfalfa. Horse physiology as they age. Decreased insulin sensitivity, Cushing's disease due to increased ACTH, equine metabolic syndrome, dysbiosis, chronic pain, and equine asthma. The changes in crude fiber for dogs with age. The crude fiber is 3 to 5%. This is to prevent constipation. Feeds with lower glycemic index. They produce lower fluctuation in blood glucose and insulin level. These are lentils and soybeans. Feed for dogs for inflammation, you get fish oils, and dog maintenance with age, it decreases with age. So cat feed intake with age. The feed intake increases to compensate for fat indigestion. And changes in diet for cats and dogs with age. You give water ad lib. You don't supplement vitamin A and D. Kidneys, normal function, and then with the same protein, but decrease sodium and phosphorus to prevent renal insufficiency. They require the same amount of protein, but to avoid muscle loss, except in the case of chronic kidney disease. And metabolic changes in senior cats and dogs. So they have glucose intolerance, insulin sensitivity decreases. Instead of gluconeogenesis, it's fat synthesis. And fat desaturation decreases, higher sensitivity to inflammation. And in cats' digestion, the digestion coefficient of fat decreases and they're less prone to obesity. The digestion coefficient of fat is the efficiency of fat to digest, fat digestion and absorption. The onset of aging. In dogs, small from 11.5 years. In cats, it's over 11 years. In medium dogs, it's 10 years. Large dog, 9 years. And giant dog, 7.5 years. Animals as they get older. The capacity of the heart and lung decrease. The kidney function decreases. They move less. The energy intake and then obesity, and then no acidification of urine leads to kidney stones in cats.